Hello, my friends. This is Andy coming to you live from Orange County, California on my new show. This is the second episode of Andy's Prostate Journal, Prostate Cancer Journal. I'm not sure if I'm going to keep that intro. I really like it, but you have to tell me in the comments if you like my my new intro. If you missed my intro, you'll see it at the end. And just give me your thoughts of whether I should keep that. I'm trying to do something eye-catching, just trying to get people's attention. This is a serious issue. I know I'm laughing and making a little bit of a joke of it, but it is a serious issue that we need to address as men and women that may be watching. Obviously, you have, obviously, but in most cases, you have men in your life that will be confronted most likely with this issue of prostate cancer. And when I got diagnosed with it, I did not want to hear that I had cancer. Period. I don't want prostate cancer, even though it's one of the most curable cancers on the planet, apparently. But I still did not want that diagnosis. So it's a very important issue that needs to be addressed. Like all men, we tend to avoid it because we don't want to have urination problems. We don't want to have erection problems. We don't want to have to deal with the pain and discomfort of carrying a bag around so that we have to pee in the bag. None of that sounds inviting or exciting. It's just like, what? Why do I have to deal with this? Hey, Paul, nice to see you. You like that opening? Very eye-catching. Well, that's what I was going for. I wanted to catch some attention in doing so. So I thought I would do a couple shows just to kind of let you know where I'm at. Paul Beyer, I hope you don't mind, has just gone through a procedure involving that. And that would be great to talk to Paul at some point about maybe remove the body part graphic. Well, see, that's the attention getting part. I used a cucumber the second time because I didn't want to overdo it with that part, but and then I covered it with the red blotch. If I get enough opinions like yours, Carol, it's probably going to be removed. A couple of people I showed it to from the female side of things thought it was cute. That was the word they used. But anyway, as we go further on my journey, we should go further on my, oh, good. That'll be great, Paul, to talk about what procedure you had and what you're going through and that kind of stuff. That would be amazing because men need to know. As much as research and study that I have done over the last 4 or 5 years, there is still not a lot of answers because everybody has a little bit of a different opinion. I didn't learn anything about a Gleason score until about 4. I'll show it to you. I'll show it to you at the end. You have to stick around for the whole show. I did not. My battery's going dead. Hold on. I got to plug this in or I'm going to lose my camera. I'm so sorry. Oh, do I have it? Okay, hold on one second. Sorry, I got to plug in my phone. My camera is connected to my phone. And hopefully I don't lose it. If I lose you, I will be back. I got to plug in my phone. And then something happens to my phone. It plays the video. There. Hold on. I got this funny little graphic. When I plug in my phone, it plays a video of Hedia spinning around on a thing at a park. Anyway, you don't need to know all that. But back to the intro. No, what was I talking about? The intro. Oh, the Gleason score. I didn't know anything about a Gleason score until literally about a year ago. And I've had this prostate cancer for about 5 years. And so I thought it might be encouraging or important to take you on this journey because I'm gonna start having a procedure done to remove the cancer. It is not one that I ever heard of. And again, I just only reason I know about this one is because Hedia told me about it. Hedia did some research and found this this procedure called Haifu. I'm going to bring it up so I can tell you the exact words of what it. Sorry about that. I touched my phone. I'm getting used to this new camera setup, so I apologize for that. It's showing up on my screen here. Hold on one second. I got to bring it back. I am messing around with this darn thing. Hold on. I got to close the thing. This is not intended to happen. It's really throwing off my mojo. Hold on. But just to tell you, there are a lot of things that I did not know, even though I was doing research, even though I was asking a lot of people who knew a lot about this particular issue in regard to prostate cancer. Not everybody had, everybody had different answers. Everybody had different cures. Everybody had different snake oils. Everybody had different procedures that they would suggest that, wow, hold on. I'm not sure. This should be showing up on its own. I hate to stick with this camera. This is really not going to make me happy. Hold on one second. I hit my phone with my hand and it caused me to lose my camera. I'm so sorry. Give me one. Well, for whatever reason, it's not going to allow me to bring back my other camera. I don't know why. So anyway, let's just get back to get back to the show. Again, the procedures, the treatments, the snake oils, the issues you need to be concerned about, not knowing anything about a Gleason score until about a year and a half ago, 2 years ago, to all these things are a little bit of a mystery. I'm not sure if Kaiser, for whatever reason, and at Kaiser who is my medical insurance, and I know I can change. I know all these things. People get on me all the time. Why are you with Kaiser? Why do you use them? I have a love-hate relationship with them, just to tell you the truth. Why don't you go to Scripps? Why don't you go to Mayo Clinic? Why don't you go to... Because there's limitations, there's reasons, and a bunch of other stuff. But why can't they get their act together? Literally, why can't they have some really good information and I don't have to actually ask for more information? It just seems like there's just so much smoke and mirrors and a whole bunch of other stuff. Now, maybe I'm just naive, and maybe I have not been looking at the right websites and that kind of stuff. I literally knew nothing about this Haifu treatment, and I had looked at a couple websites and talked to a couple people that had some idea about prostate cancer, but not one of them brought up this Haifu. So I'm giving you all this just as a reason why I think I would like to do something like this every so often, maybe out once a week or once every 2 weeks. I'll come on and talk about my journey, some of the things I'm learning along the way, and maybe it'll help somebody else. All right. Hope that all made sense in the midst of my camera issues that completely threw me off, by the way. So this Gleason score, my Gleason score is a 6. Or at least it was the last time I went and had the PSA and the biopsy and all that kind of stuff. The oncologist that I went to informed me about this Gleason score. He goes, "Oh, nobody ever told you that before?" No, I've never heard about a Gleason score, but it's a 6. That means I have a bunch of 3s, whatever that means. And you add 3 plus 3 and it gives you a 6. Now, I did a whole presentation on this right when I learned about it because it was fresh in my mind. He explained everything to me. So I came on and did a show on my Gleason score and my PSA and the determination of a wait and watch type of a wait and watch is what I was doing, as opposed to having treatment done right away to see which way my PSA and Gleason score was going to go for a period of time. And then based on what it did next, it was going to determine what procedure I have next, whether it was chemotherapy or what have you, complete removal. A whole bunch of decisions were going to have to be made if my PSA went up and my Gleason score went up. So I did a presentation at that time. I will have to go back and see if I can find the video because I've already forgotten everything that I taught on that particular day. It's already gone out of my mind. So I would like to bring that video back if it's worthwhile bringing back and talk a little bit more about that. So let's talk about what's happening today. What I did the other day was I took 2 scans. On one day, I took a bone scan, and then 2 days later, I did a CT scan or a CAT scan. Based on the recommendation of my Haifu doctor, the Haifu doctor said, I would like for you, because your scores are going up very quickly, I would like you to have a bone scan done. If you can have Kaiser do it, that would be great, or go outside of Kaiser and get it done, just to make sure the cancer had not spread anywhere else. Before I go any further, because of the camera issues that I had, I meant to show these graphics. The first one is a disclaimer. This one should have been right off the bat, but let me go ahead and get this disclaimer just to make sure I'm covering my bases. And that is a disclaimer. I am not a doctor or claim to be one. I am sharing my opinions and experience only. I am not diagnosing nor suggesting you use any particular treatment treatment or procedure. Any content provided by our bloggers or authors or guests that I might have on the show are of their opinion and are not intended to malign any medical treatment, organization, religion, ethnic group, club, organization, company, individual, or anyone or anything else. All right, that's an important disclaimer that I put up there to make sure you understand that this is just a show sharing with you what my experiences are, and if I have any guests, we're just going to share their experiences and expertise. I'm not giving you any medical advice whatsoever. All right, so there's that. So I'm going to get to that. Thanks, sir. And Paul was asking me what my PSA is. So my PSA has been going up consistently. And so let me just share that with you. And so back on 7/31/2020, it was 14.2. And then on 8/21/2020, it was 15.1. And then just a couple weeks ago, February 5th, 2021, it went to 16.5. So this kind of rushed everything as it's consistently going up. It's just no doubt that we should not wait to do something in some sort of procedure. So at that point, I don't know if my Gleason scores remain the same. I have not asked about that. This is just, again, suddenly come up. And so that is the reason I decided to use this show as a means of communicating and sharing with you everything that we're doing. And you will almost real time get to see what's happening as far as I'm going. Now, the good news is I'm not doing this on my own. I'm pretty... I've been avoiding this for a very long period of time. Again, there might be other guys like me out there that have been just avoiding. You've been told you have prostate cancer. You've been told that it's that it's minor. You've been told that maybe you can monitor it. You've been told you can have some type of treatment, but nobody ever has the right answer or seemingly the right answer. And so you could be like me, where have been kind of just avoiding it and hoping it's going to go away. You can't believe all the vitamins I've taken that are supposed to help with prostate cancer. The water that I'm drinking to the CBD and all the other stuff that I've been taking, hoping that it would just simply go away. And obviously, based on what you saw there, it is not going away. It's actually going up. So I will share some of those things with you just to tell you what it is in another show, just to go over the list of things I've tried over the last 2 years or so. For me, it may have, who knows? It may have slowed it down. I don't know. But for me, it has been consistently going up on a fairly regular basis. And so I will share some of those things with you later on. So when I went and had my bone scan done the other day and my CAT scan, the doctor called today. And the good news is I had nothing. I'm negative on all the scans. Nothing has showed up anywhere other than a concerning spot. Now you can't see it because my camera's gone down on my ribs. Apparently there's like a little thing on my ribs that was some concern. And through the CT scan that I did after the bone scan, the doctor was able to zoom in on that area. And the only thing he can think of is it's quite possibly some arthritis on my rib. I didn't know you could get arthritis on your rib, but apparently you can. So apparently there's just a little spot. He goes, it's not even big. It's just this little tiny spot. And the reason that they wanted me possibly to come in for another x-ray is because it's so small that they couldn't see exactly what it looked like, the makeup of it and that kind of stuff. And so the suggestion was that I would come in for an x-ray, but then remembering that I had a CAT scan done, he said the CAT scan is a much clearer picture of things. And so they zoomed in on that spot using the CAT scan and were able to see that it's nothing, that it's something probably more related to some type of arthritis or something like that. So the good news is it sounds like so far that I will be able to continue forward with the Haifu treatment, because it doesn't look like anything else in my body has been affected by cancer. It's still localized on the prostate, and we kind of laugh about it's on the dark side of the moon. It's on an area of my prostate that's not easy to get to, and it's on the backside, and it's a very difficult area to operate on. And so the Haifu doctor, and I'm going to share everything in regard to the Haifu doctor. I'm just trying to keep this focus on, where we're at this point. Says that although it's one of those spots, he's done thousands of them, these procedures, and he feels confident that he could take care of it with the Haifu treatment and that kind of stuff. So just the update. The update is I had a bone scan and a CAT scan, all came back negative. There was a spot that they saw that they might have some concern. They looked at it closer, and there's nothing there. So very, very cool for me. And Paul says, I put off for years active surveillance. That's what I was doing, of course, until my PSA hit 23. Wow. That seems really high compared. I'm glad you are seeking treatment. Now, see, this is the thing. I hear you at 23. When I was at 14, they were already talking about me having some type of, of cancer treatment, whether it was, or removal, right? They were saying they gave me like 5 options, like 5 different things I could choose from. It seems like 5, it might've been 3, but it seemed like they gave me 5 different options that I could choose that all had really bad side effects, right? The side effects were you don't get an erection any longer. There's another side effects is that you have to wear a bag for a very long period of time. A pee bag, whatever I forget what they call that. It's escaping me now. I'm sure somebody will put it up there in a minute. But that was at 14. And to hear that, Paul, that you were at 23 is like, I had no intention of even getting into the 20s before I decided to do something. So, wow. So I can't wait to talk to you, Paul. We'll make arrangements for you to come on. You could either do it over phone. I have a way of hooking you up over phone, or you come on camera and I'll send you the link and you come on camera with me. So just let me know which way you prefer, and we'll set that up over the next couple of days about, your experience with your prostate cancer. So that's where I'm at right now. Those are the 2 tests that I had. They came back negative. It looks like I'm going to be going forward. I'm going to be setting up a time, hopefully, to interview the doctor so he can explain Haifu more professionally than I can. That's why I'm kind of putting it off, because I'm hoping a catheter. Thank you. Yeah, a catheter. Yeah, I don't want that. And so hopefully I can get him to come on and explain it so that I'm not messing anything up with my explanation, so that we can hear from him. I had an hour. I think Hetty and I, was about an hour long meeting with the doctor, and he went over everything, and we feel very comfortable with this doctor. We don't feel that he's a witch doctor. We don't feel that it's some treatment out of a third world country. It's here in the United States, and he gave us a lot of information about it and where it's being used, how long it's been around, and all that kind of stuff, and feel very comfortable with this particular treatment. So we'll have him come on and explain it much better than I can. All you need to do is type in HIFA, cancer treatment. HIFO. Sorry. Oh, no, you. Hold on. See, I can't even get the thing right. Haifu cancer. HIFU attacks tumors with laser-like precision. And so, yeah, Haifu, Hifu. So you see why I don't want to do anything that's going to jeopardize the information, because I can't even get the acronym correct. But we'll be talking about that further and going a little bit deeper. I am so sorry about the camera. That completely threw everything off, and I apologize. But these things happen once you're doing these things. So once again, just in case you're joining, so my PSAs have gone from 14.2 to 15.1 to 16.5 since July of 2020. So almost 2 complete points between July and that's, what is that? Not very long. And so that is the reason why we're moving forward with some type of treatment. And there you go. All right. So I'll be giving you an update. I will make sure and get my electronics. So I keep looking at the camera that's up there. I'll get my electronics worked out so that we don't lose a camera in the middle of the show. Thank God we have a backup camera and able to do that. And again, I'm going to play the intro. Make sure you let me know. I'll actually leave the show running for a couple seconds afterwards for you to type in your comments whether you like the intro or not. But I want people to know exactly what this is about. And I think the graphics that I use are completely appropriate. And I've even had a couple of people say that it's cute. But Carol doesn't, she just said maybe not that first. I'm not saying she doesn't like it. I'm just saying she goes maybe do without one of the first graphics is on there. So let me know what your thoughts are on that particular aspect of our show. All right, my friends. So I'll be talking to you later on this important topic of prostate cancer and the process that I'm going through, and eventually we'll be sharing with you the treatment. I'm going to actually try to take you into the operating room. It's to some extent. I'm not sure how he can do that, if he's going to make us record it or do it live. I'm not sure. It would be great to do it live, I think, but we'll see what happens and see what I can talk him into. He has agreed to go on camera, the doctor, and show me and show all of you the procedure and what happened, how it's done. I'm just not sure of the actual procedure when it's being done. I mean, what he's willing to show. So I'll work on it though. I'm going to try to get him to get a live camera in the operating room. I don't know if there's any laws against that in California. Who knows? But I'll try to figure all that part out. All right. Here's the intro. I'm playing it as the outro. Let me know what your thoughts are. Take care. Talk to you later. Bye.